Knowledge is power when it comes to heart disease, the #1 killer of men and women in the United States. But according to a Cleveland Clinic survey, Americans don't know as much as they should. In fact, 87% believe cardiac arrest is another term for heart attack, but they're very different.
Somebody who has had a cardiac arrest, that's not the same as a heart attack. Cardiac arrest is when the heart is either beating wildly or not beating at all, and there's no blood flow.
CPR can be a lifesaver during cardiac arrest, but the survey shows only 1 in 6 people know the recommended technique.
There's been a change in recent years to chest compressions only without mouth-to-mouth breathing. And so most people didn't know, or many people didn't know, that in the adult, really all you have to do is do those chest compressions. And many people didn't know the rate at which to do them. The best rate is somewhere between 100 and 120 times a minute.
When it comes to a heart attack where a coronary artery becomes blocked, people often confuse the symptoms with those of a stroke.
Many people in our survey thought that having slurred speech or weakness is actually a symptom of a heart attack, when in fact that's a symptom of a stroke. People that have a heart attack, most people, are going to have pain, usually in the center of the chest. It can go to the jaw or down the left or down both arms. It's often associated with nausea or shortness of breath.
The survey also finds that most people having a heart attack know to call 911 first, but only about a third know to chew an aspirin as well.
Many people don't know that it's a good idea to chew an aspirin, not a baby aspirin, but a full-sized 325 milligrams of aspirin. That can actually, in a few cases, can actually stop a heart attack.
In addition to calling 911 and chewing an aspirin, Dr. Nissen recommends taking nitroglycerin if you have it. At Cleveland Clinic, I'm Erica Foreman.